us now to offer suggestions on how to cope with stress and anxiety in the age of coronavirus is Chandra Ghosh Ippen, a child psychologist and the Associate Director of the Child Trauma Research Program at UCSF. Chandra, thank you so much for taking a few moments with us.
Thank you for having me.
So this is obviously an incredibly rare moment, not just in California, but in the world. We're living with a trauma that is really has no certain ending, one that's changing rapidly. And now we're all being asked to distance ourselves from most people in our lives. What tips do you have for coping as adults with what's happening right now, especially the social distancing and uncertainty?
I think the first tip I have is really just to acknowledge that we're going through this and to really acknowledge the feelings that we're having in our body. That it would be very normal to feel anxious, very normal to feel sad, and that we want to really not fight against that in ourselves and to be kind to ourselves. And then we want to think about the ways that we can enhance our emotion regulation and our coping. To think about what are we doing for our bodies? How are we moving? We know that when we're under stress that our bodies are designed to actually generate chemicals that make us fight or flee. And so if we are in our homes and not moving, those chemicals are in our body and they'll actually affect not only our emotional health, but our physical health and our relationships. And so how do we move at home? How do we have dance parties? And then how do we think about those people who are around us, like our kids?
Right.
Because we want to think about how stress is catching.
Yeah. Well, talk about that. How should we be talking to our children about this? And how should we be listening to them?
That's a really great question. So first, I think we want to make sure that we all acknowledge, I work with very young children under the age of 6, and we often think that they're not listening to us. And it's critical to think about how they're hearing our words, they're hearing our phone conversations, and they're also listening to our bodies. And so stress is kind of catching. And so we want to open that conversation with them to think about what they're hearing and to really, I guess, again, going back to that acknowledge to say, right now mom is feeling stressed or a little bit sad because we don't see people. And then to think about how do you feel? I really liked how you said, how are we listening to them as well? Because as grown-ups, it's critical that we make that space.
Yeah, I mean, I feel like sometimes it doesn't always feel like our kids hear us when we say those things, but it sounds like what you're saying is what I think most parents eventually realize is that little ears are picking up on things, even if they don't understand it all.
Completely. We describe them as sort of little sponges with huge ears. And sometimes when we talk directly to them, like we say, what are you hearing? Or, what do you know about the virus? They might walk away from us. And then very oddly at bath time or at bedtime, they're not just stalling, but that's a time when their little minds are going. And they'll ask you questions. And it's important at those moments to really make the time because it's like a moment has opened up when they can really open up and share their fears with you. And there's a nice phrase of what is shareable is bearable. And this idea that we don't want to stay with those feelings inside, that's really why I started with how we acknowledge to the people around us how we're doing.
Yeah. I mean, one of the challenging things here, of course, is the fact that many of us are in this situation where we're suddenly expected to be at home with our kids, still do our jobs, and want to make sure that they're not falling too far behind on school or learning. Can you talk about the sort of balance between the structure and education kids need and how we can sort of make sure we're not overloading ourselves as parents?
Sure. I think that we know that young children and children in general feel safe when there's a routine, when things are predictable. We also know that if we adhere too rigidly to things and we don't listen to the individual child, that can cause challenges as well. So it's really a balance. So one thing I might think about is what are the different things that we need to do and how do we help our children help us to set a family schedule? And then within that family schedule, how are we thinking about relationship breaks and body breaks? Right? So relationship breaks being we are working really hard. And one of the things we know is as working parents is that the minute you're working hard, that's when your kids most need you.
Yeah.
Right? So we need our work environments to, one, be tolerant of that. I know that as a mental health professional, when I'm on Skype calls with other professionals, we're really trying to acknowledge that our children may be coming in and having questions. And how are we kind to one another about that, recognizing that our first priority as a society is to really support children and to support our anxiety.
Yeah.
And then we will get our work done. So we are flexing our work roles, becoming more tolerant of the fact that we have families. This may really help us to think about what is a good work-life balance under coronavirus and long term.
Yeah, definitely. Quickly, I want to ask you, we've been hearing a range of stories about how seriously people are taking these stay-at-home orders. In particular, I've had a lot of discussions with people about how their parents don't seem to be taking this as seriously, or we've heard stories about younger people still going out to party. Do you have any tips on how to talk about this without sort of alienating people?
That's a really good question. I think one thing that we think about is that society is sort of like a protective shield, that we want to be bigger, wiser, stronger, kind, and that at different points in our history, we've had people who've been vulnerable. And that one of our tasks is to come together and to protect those among us who are most vulnerable. And so as we have a national narrative around this, that it doesn't necessarily, that you might not be worried for yourself, but that there are people that you love that you might be worried for.
Yeah.
And so how do we join together, and how do we say, look, we're worried for our healthcare workers. We're worried for our nurses. We're worried for the people at the grocery stores, and we want to minimize risk to these people so they can continue doing their job. We're worried for our elderly parents, who often are actually caring for young children. And what would that be like? So we don't want to make people scared, but we also want people to think about social responsibility.
Yeah. Chandra, I'd like to end on a hopeful note. It seems to me that despite the trauma and grief here, there's opportunities in coming together, positive outcomes perhaps of all of this. Can you talk about what you see as the potential silver lining?
I think one thing that this will do is shine a spotlight on the emotional needs of people in our communities, that it will make it okay to talk about feeling sad, feeling angry, and feeling anxious. And that hopefully we'll also see that we're learning new ways, new things that we can do when we feel that way, and that we're having more tools be developed. We're having a lot of professionals really think about how we provide telehealth support so that we can reach communities that have traditionally been underserved, like our rural communities, people who aren't going out. And so hopefully we'll see more people really saying, I need help, and we'll have more help being offered.
All right. Chandra Ghosh Ippen joining us from her home in San Francisco via Skype. She is a child psychologist at UCSF. Thank you so much for all of your help today.
Thank you.